evening, everyone. Uh, Thank you so much for joining us for the Empowering Families to Strengthen Youth Mental Health presentation. My name is Cindy Shireman. I work in community engagement for Mayo Clinic Health System, and it is my pleasure to moderate tonight's event. We are going to devote time for your questions towards the end of the presentation, and you can submit those questions using the Q&A feature at the bottom of your screen. Everyone who registered for this event will receive a recording of the presentation in a follow-up email. Now, I am pleased to introduce our speaker, Janice Schreier. Janice is a child and adolescent clinical therapist at Mayo Clinic Health System in La Crosse and has been working in behavioral health for 12 years. She has seen firsthand the significant rise in the number of youth being referred for mental health services. Tonight, she will share a multifaceted approach for families to help manage youth mental health issues such as depression and anxiety. Now, Janice, I will hand it over to you.
Thank you, Cindy. I appreciate this opportunity. I've been looking forward to talking to families and any youth that are participating tonight too, on different ways that we can help people learn how to better manage anxiety and depression. Addressing the mental health of youth has become a public health priority, as a lot of you already know. But well before the pandemic, we were seeing rates of behavioral health conditions affecting youth that had been escalating. The pandemic just accelerated the issue. We have increased rates of depression, anxiety, substance use disorders, suicidal ideation. Unfortunately, the problem is that the supply of mental health resources is not meeting the demand. And a lot of families already know this by trying to get involved with mental health care. So part of the reason we're doing this presentation is to talk to families, talk to youth about ways that they can put some different techniques into place that will help them mitigate some of the severity of symptoms. And that's the good news, that there are things that kids, that adults, that families can do to help improve symptoms of depression and anxiety. Now, as we begin talking about this today, I want to challenge listeners to consider treating physical health and mental health conditions in a similar manner. When we do this, it increases the expectations of care and it improves quality and reduces stigma. So I'm just going to touch on that briefly because a lot of you are pretty familiar with medical care, physical care, and the importance of having high quality physical care. But we also want that for our mental health care too. All right, now I just need to move to the next. There we go, mental health. So I want to talk about how they're related. So mental health and physical health are interconnected. You can't have one without the other, right? They're both related. So when we improve physical health, we're improving mental health. If I see somebody with an anxiety disorder, treat that anxiety disorder successfully, they are likely to see a reduction in pain, in headaches and stomach aches. Treating their mental health improves their physical health. Treatment isn't one and done. Treatment for physical conditions and medical conditions, or physical and mental health conditions, is largely a multifaceted approach. When we think of medical conditions like diabetes, type 1 diabetes, I have a son who has type 1 diabetes, and one of the first things we think of is insulin. We treat type 1 diabetes with insulin. This is true, but we also treat it with checking his blood sugars. He checks it or manage it by physical activity, increased fluid intake. He also manages it by following a low carbohydrate diet. So many things help him. And the more he does of those, the better off his health is. This is the same thing with mental health. I'm going to be giving you more than one option, idea. I'm going to be talking about different things that you can do because there isn't just one thing that needs to be done. The best methods of treatment are tried and tested, evidence-based treatment based on evidence. When I look at, I have a family member that has cancer, right? When we look at cancer, I want my doctor to be treating my family member with treatment that has been tested and it works. We know that through evidence that cancer can be treated with chemotherapy, surgery, radiation, right? I'm going to be talking to you tonight about treatment options, things that'll work for your children that have been tested and proven to work. And finally, you must be an active participant in treatment. We can't just be passively getting treatment. And this is the same, say you want to work on obesity, right? You can't just read a book about obesity. That's helpful, right? But we also have to be active participants. Maybe we're increasing water intake. Maybe we're getting some physical activity or increasing protein. But it takes active approaches to see improvement in physical health. And it takes active approaches to see some improvement in mental health too. All right, so I want to jump in with a little quiz. So for everybody, well, before I jump in with the quiz, I want to talk about this imbalance in life, okay? So before I jump in, you want to think about depression as not just a chemical imbalance in the brain. So we have that chemical imbalance in the brain, but we also have what I would like to call a imbalance in life, that depression can result in some of the ways we live. For example, if you're lonely, you're more likely to be depressed. If you're sleep deprived, you're more likely to be depressed. If you can't identify areas of meaning in your life, you're more likely to be depressed. If you have no control over your health, your work, or school, you have more likely to be depressed. All right, so we're gonna do a little break here, a little commercial for you. Right? What is one simple daily habit that, if practiced correctly, would boost your child's mental health threefold, improve their grades and enjoyment of school, make them a better athlete, dramatically reduce their anxiety and stress, cut their chances of getting in a car accident in half, ward off chronic health conditions like type 2 diabetes and obesity? It costs $0 and it's completely natural. I know it's a tough one. It's sleep. So we're going to start talking about sleep. But before we do that, I want to go back. Oh, I wonder if I can go back. You think I can go back? Oop, there. We're going to go back one. We're going to talk about a recipe card. I created this depression and anxiety management recipe card after working with teens and youth and finding that they're very visual learners. Okay? So this anxiety depression management recipe card is a recipe of the multiple things that are effective for managing depression and anxiety. And one of these is sleep, which we're going to go into in a minute. But we're also going to go into a number of other ones of these, okay? These are all things that have been proven through testing and research to work. And I'll be talking about some of this tonight. This recipe card is like any recipe. The more we use of it, the better the recipe. However, if we miss one, you know what? We're still going to have a pretty good recipe. Some of the ingredients are a little bit more important and essential to get, but we need to make a good recipe, we need multiple ingredients. Medication may be one, but not for everybody. So I have daily medications on there as one option, right? So we're going to be going through these, what makes for good mental health, and just diving a little deeper into it, okay? Sorry, I put this out of order. Sleep. I know. Who would have thought that sleep would be one of them? But sleep and mental health are actually inextricably linked. An estimated 90% of kids with depression have sleep problems. And I've seen this reflected time and again in my practice when I ask kids, how many hours of sleep do you get? I get a lot of responses of 5 hours, 6 hours of sleep a night. If you are concerned about your child's mental health, the first step I would look at is their sleep. Adequate amount of sleep is actually 8 hours, optimal is 9. If your youth were allowed to just sleep, and we were to time their head on the bed sleeping time, it would be 9.5 hours of sleep. If kids are missing 2 hours of sleep a night, they are essentially doubling the risk for depression. Doubling. So we can improve our chances of treating depression by increasing or improving our sleep. A lot of our kids are staying awake and they might say they're sleeping, but if their eyes are open, that's not actual sleep. I'm talking head on the bed, eyes closed, sleep. Right now, our teens are actually in the midst of the worst case of deprivation of sleep that has been experienced by any population in history. While the majority of younger kids, like elementary school kids, get optimal sleep, kids in middle school, about 30% are getting optimal sleep. And by the time we get to a senior in high school, it's about 5%. I think most of you probably know one of the factors that play into this, and it is electronics. It's the electronics that are keeping people awake longer at night. Um, Kids might say, I went to bed at 10 o'clock and then I got up at 6. Okay, that sounds good. Did you have your phone on? What time did you put your phone down? It was off, not on the bed, and you closed your eyes. Oh, that was 11:30. We can't count 10 to 11:30. That's not sleeping. You're in bed, but you're not sleeping. So we want to look at head to bed. Time of sleep should be 8 to 9.5 hours a night. Here's a little chart that gives you this visual, because as I said, I'm more of a visual person, about what too little sleep does and what a healthy amount of sleep does. Sleep deprivation causes actual wear and tear on our brain. If you look at the first one, it says short temper. Sleep loss raises stress levels and decreases the brain's emotional regulation pathways. A sleep deprived brain sees the world through a negative lens and skews towards sadness, frustration, anger, and hopelessness. Now, unlike tired and sleepy adults, we get kind of listless and slow. Kids become more hyperactive, explosive, and they try to compensate with extra energy, with that anger. Now, if we look on the right, on the other side, the blue screen, it says healthy amounts of sleep. This is some really great stuff that's going on when we get good sleep. It's improving our immune system. It is decreasing inflammation. It's lowering risk of chronic disease. These are all things that have been well researched. Sleep is what is breathing life into our brain, and it's releasing these neurochemicals like serotonin and dopamine. And this is the fuel that gives teens passion, excitement, new ideas. And I mentioned those two words, serotonin and dopamine, right? Like they're acting as an antidepressant. Our sleep acts as an antidepressant for us. Sleep is a recharge. So during sleep, the brain is actually cleansing itself. It's like flushing out its own waste. It's cleaning up that brain. Uninterrupted sleep is vital for kids because the growth hormone that is needed for tissue and muscle development is released at night. It's primarily released, interestingly enough, between midnight and 6 a.m. So we really want our kids sleeping between that midnight and 6 a.m. because that's where they're going to get the most benefit. If there was one thing I could recommend, it would be to move out electronics out of the bedroom or even use a special software to minimize their impact. The sleep problems, as I had mentioned, have increased significantly over the years, and it is largely due to electronics being in the bedroom. So simply removing the electronics is one way to improve sleep. There are many others, but if you can do this one thing, it's going to significantly improve their sleep. If we look at how often the phone goes off, how often it dings, the blue light that they're looking at makes it harder for them to fall asleep. And we want to protect the sleep. So sleep, increasing optimal sleep is one antidepressant for kids. All right. We went through one. And to be honest with you, I could talk about each one of these for a couple hours at a time, but Cindy said I couldn't have 3 hours tonight, that I could only speak for an hour. So I want to give you a couple of different things. So I'm kind of glossing over some of this. So number one is sleep. It's a great antidepressant. Think about if we combine sleep and an actual antidepressant. We're taking two antidepressants at the same time. Let's look at another one. This is probably my favorite. I actually use physical activity, exercise, as my own antidepressant. I have generalized anxiety disorder, and I find that this is very effective for managing anxiety. It also improves sleep. I'm sorry, I can't stop talking about sleep, but exercise improves sleep. It is also an underutilized antidepressant that increases some of these great neurochemicals. When we're physically active, these feel good transmitters are released. They light up these pathways in our brain and they enhance energy and mood and motivation. It's a really potent antidepressant. I was reading some articles on the effects of exercise because I want to only present stuff that's been proven to be effective for depression and anxiety. And I found two landmark clinical trials that Duke tested. They had tested Zoloft, which is an antidepressant. So Duke University tested Zoloft against 3 times a week, 30 minutes of exercise. And it was found to be as effective as Zoloft, the antidepressant, at fighting clinical depression. How awesome is that? 3 times a week, 30 minutes of exercise. Now, I have a lot of families that tell me, my kids aren't interested in exercise, they don't want to do it. That's okay, especially for youth. I want you to really focus on physical activity as something that's fun. If they're in sports, encourage sports. Some kids don't like specific sports, so then it's encouraging them to do other things, right? You want to find, for a lot of kids, especially youth, I'm finding that having a partner and routine are key. As an adult, I find a partner and routine are key, right? So physical activity is something, if you're wanting to use it as an antidepressant, it's important that we make it routine. Think about all the things that you do that are routine that you don't even think about. I go to the bathroom, I wash my hands, it's just routine. I brush my teeth before I go to bed, it's just routine. Kids just go to school every morning, it's just routine. We want to make this as part of their routine. So it's scheduled at the same time every day. And by increasing and having increased activity, we're going to see that improved mood. This can just take a week or two. It can be pretty sudden where you can see the big jump in mood. You will even see a bump in mood after that first physical activity, that first workout. So routine and a partner, having somebody to work out with. So for kids, it might be joining a group. It might be joining a walking group, might be joining sports. It might be doing activities with parents, joining in with parents. Could be the why. I mentioned earlier that this is my number one way how I manage anxiety and depression is through activity. So I actually put this into play with a partner and routine as key. This is my running group, and if they're watching this, they're going to be thrilled to see this. But every morning, 5:30 in the morning, I wake up out of a dead sleep and I go for a run. I run 5 mornings a week. Routine. The routine is so that when I wake up, I don't think, should I do this or shouldn't. I do this every morning. This is what I do. I just routine do it. By having people to meet, it makes it much easier to do it. So routine, partner or partners are key to increasing the compliance and the interest. We need to find things that kids like to do. If your child prefers to do physical activities with parents, with family, that's a great way to implement it too. All right, let's jump into another one. So this is dealing with your problems head on. The fears we don't face become our limits. So everybody just kind of thinks about some of the fears that they have dealt with throughout life, some of the things that they haven't dealt with, right? As adults, when we're afraid of things, we tend to ignore it and it'll go away. If I don't want to deal with it, I'm just going to ignore it. It'll eventually go away. And for our kids, we're seeing this increased anxiety and depression because a lot of them aren't dealing with some of the problems that are going on. Let's look at a couple of examples. So if I have a child that's dealing with bullying, They go to school all day and they're dealing with bullying, and then they come home. We ask how they're doing. They're like, it's fine. Everything's fine. But they keep going back and they keep going back and they don't ever deal with it. It's not going to just stop. It's not going to just go away. This is a child that we want to help them. We want to either teach them some assertiveness skills, or maybe we need to intervene as a parent or as a therapist or as a teacher or as a friend. So we want to deal with those kind of things head on. We want to teach our children whatever issues you're dealing with, we have to take it out and deal with it head on. Social anxiety. We've seen so many kids struggle with anxiety because of the pandemic. They had a year where they were off school, they were doing things online. Um, they weren't challenged socially. They were spending a lot of time socializing online. So they go back to school and they find it harder and harder to talk to kids. So if the fear they're not facing is, I fear talking to people, I fear starting conversations with friends, we want them to face that fear. We want to teach them how to face that fear and face it head on. So we teach them skills on how to face fear so that they're able to manage this anxiety and depression better. So this is parents helping them get involved with things, get them more active. Let's say the problem is ADHD. I do a lot of work with ADHD. Child maybe has ADHD. Parents don't want to deal with it. Kids not dealing with it. We need to take that out and look at it and say, you have ADHD, you're struggling with focus in school. Let's take that out and let's work on it and figure out how are we going to deal with this problem head on. Maybe it's relationship issues with parents, family members. Instead of ignoring it and hoping it'll go away, we want to take those problems out and deal with it as a family. Maybe it's a breakup with a boyfriend or a girlfriend. We want our kids to come to us and talk to us about some of those problems so we can help them deal with it head on. Sometimes it's LGBTQ plus issues. A lot of our kids that are dealing with these issues feel like they have to keep it inside and they don't talk about it. They might talk about it with their friends, which makes me a little nervous. A seventh grader going to their seventh grade friends for advice on how to manage some difficult emotions. Instead, I want them coming to a trusted adult and talking to them about, I'm feeling like this and I don't know how to manage that. We want them opening up about their problems instead of avoiding dealing with those problems. This is pretty common in the physical health world too. At the beginning, I mentioned there's a lot of similarities between medical conditions and mental health conditions. A lot of times, if we're dealing with some medical stuff, we kind of avoid it and hope it'll go away. Years ago, I got a really bad cough and congestion. This was before COVID. So I was able to get away with still going to work, coughing and, being congested, and nobody was freaked out about it. I still went. And I was like, I got to deal with it. I know I need to deal with it, but I'm really busy. I'm raising 3 kids. I'm working. Um, I got lots of stuff going on. So I'll deal with it later. It'll go away. Whatever this is, this will go away. Um, I finally, after a month, decided it's not really going away. I should maybe do something. Scheduled an appointment with my doctor, went in, got diagnosed with double pneumonia. He's like, this is, this isn't good. I'm like, ugh, ugh. I thought it would go away. He knew me well enough to say, Janice, that's a little ridiculous. It's not going to go away without medication. You need to have an antibiotic for this to go away. So I avoided it, hoping it'll go away. Instead, it got worse. And it affected me for a month instead of going on an antibiotic and dealing with it right away. This is the same with mental health problems too. If you're dealing with depression and we just ignore our child's depression, or we ignore their anxiety, hoping it'll go away, or they'll outgrow it, it's typical teenage issues. It isn't going to just go away. Depression doesn't just go away. We can't just smile or snap our fingers and hope it'll go away. We need to take it out. We need to deal with it heads on. And kids cannot deal with depression by themselves. And I don't want to see them dealing with depression with just their peers. I want them to have other outlets to help them learn how to deal with depression and anxiety. So this is really an important one, is teaching people, teaching kids, encouraging our kids to deal with these problems head on. I want to talk about my favorite one next. So we got the depression and anxiety management recipe card, and I'll come back to this at the very end too. I got a lot on it, but when we look at it, we've talked about dealing with problems head on. You face your fears to get control over your anxiety, because we want to get control. We want to be able to manage this, right? We talked about exercise. We talked about sleep hygiene, some really natural antidepressants that are really important for managing and improving the severity of symptoms. My favorite one has become more important because of the pandemic. It has become a big problem because of the pandemic. Before the pandemic, our world looked different. Once the pandemic hit, I noticed that lots of clubs stopped meeting, activities were no longer going on. Kids were participating in less things face to face, more isolation. So this is my favorite one, and one of the ones I think is most important is social supports. At its worst, depression is a disease of isolation. People generally tend to be social creatures. We feel best when we are connected to others in our community, work community, school community, family members. People need to feel like they belong. We need to feel like people value us, like they need us. There was some research that came out in 2020, and it showed that 52% of Americans have reported feeling lonely. Half of Americans are reporting loneliness. This was a Harvard study that was doing some research during the pandemic and found this. Spiked a lot, especially that first year, but it hasn't really gone down since the pandemic has lessened. It's most significant for young people. So we saw across the board that loneliness had increased for every age range, but it had increased the most for our young people, for our youth. Studies have also demonstrated that social isolation and loneliness are associated with a greater risk of poor mental health, but also poor cardiovascular health. So not only are mental health conditions affected by loneliness, but our physical health is also affected by loneliness. Other studies have shown the benefit of a network of social supports, including the following. It improves the ability to cope with stressful situations. When we have a tribe of people, remember I showed you my tribe of running group people. If I'm going through a stressful time, just venting to them automatically makes me feel better. They don't need to solve my problem. I don't need them to solve it. I just venting to them. So it improves the ability to cope with stressful situations. It alleviates the effects of emotional distress. Promotes good mental health, being able to tell people, talk to people, share issues, open up with people. This improves our good mental health. It enhances self-esteem. When we have other people, we know they value us. If we look at these three boys from a very popular TV show, look how happy they are with each other, right? The boy in the middle is maybe making one of the others laugh. It feels good to make people laugh. When you make someone laugh, you're getting a little dopamine rush. You're like, that felt good. And the kid who's laughing, he's getting a little dopamine rush too. This is improving our health, our physical health, our mental health. It lowers cardiovascular risks, such as lowering blood pressure, and it promotes healthy lifestyle changes. How often are we with a group of friends and we don't start laughing? I mean, I feel like when I'm with friends, I'm laughing a lot. There is some research that shows the average adult laughs like 15 times a day, but little kids are laughing like 150 times a day. Wow, no wonder we don't see any depression in these 3 and 4-year-olds, right? They're laughing, everything's funny. But once we get to middle school, high school, adulthood, we're laughing less. When with people, we're going to be spending more time laughing and enjoying ourselves. How many of you are sitting by yourself? Maybe, maybe you're on the computer, or maybe you're reading, or working on something. And how often do you just start laughing uncontrollably? It might happen once in a while, but it's not a frequent thing. The social supports are important for this. The thing is, you want to encourage kids to increase their time in social supports. One reason is social anxiety has increased, so it's made it so some kids will tell you, I don't want to do something, when really what they mean is, I'm too anxious to it. Okay. But we still want them involved in, maybe it's sports. I have 2 boys that would join any sports they can. I love sports. And I have a son that is not interested in sports. So my pushing him to develop social supports in sports, that's not going to really benefit him. Instead, push him to engage in more outdoor activities like trap shooting group or a fishing club, or there's archery groups, right? For some kids, it's school activities that are related more to I don't know, social clubs, or maybe presentation clubs. It could be leadership clubs. For other kids, it can be youth groups. If kids are really struggling to connect in school, it might be helping them connect through youth groups at church. You don't necessarily need to be a member of a church for your child to attend a youth group. Most churches will allow your child to attend their youth group. They're welcoming and they're encouraging. So it's finding some of those where they can connect with other kids. It could be volunteering. So encouraging kids to volunteer with other people. There's teen centers, different places, different things in each community. Classes. Um, I know, fun story. I met a very good friend of mine. I don't know if she's listening tonight, but I met a very good friend of mine 21 years ago when we took a Lamaze class together. Didn't know her at all. I still know her just from taking a simple Lamaze class together. We're still connected. So taking classes together is one way, taking fun classes, educational classes, classes outside of school that can help them develop friendships. And if nothing else, you develop your own. If there's not something for your child, you develop it. I had a child that was trying to find clubs for him, and there wasn't anything fitting, loved Pokemon. So we developed a Pokemon club. And they played Pokemon. They had Pokemon cards, and I don't know enough about Pokemon, but they got it up, and we got it up and going, because if it's not there, you develop it and you find other kids. This is something, it's going to take some parent support, but um, there are opportunities out there, but sometimes we have to develop these opportunities with our kids. So social supports have also been shown to be super effective for recovery from addiction. Um, it's helpful for recovery from so many different mental health conditions. It helps with anxiety. It helps with recovery, depression, confidence, self-esteem. So this is my favorite one because this is the one where I see the most benefit. When I get to see a group of kids together laughing and having fun and engaged, I find that to be more effective than any other treatment that I can give them. All right, let's go through another one. Another one that is really important that I want to challenge parents on, because there's a lot of parents here tonight. There's some youth, there's some parents, there's teachers. I think a lot of people have a role in helping kids with mental health, but families are especially important for helping kids with managing depression and anxiety. I was reading some work on Dr. Paul Sanseri. He's a psychologist. He did a sample of 27,000 families with children with mental health problems and found that families that fight, argue, don't listen to each other, families that lead disconnected lives, those families that kids live in the bedrooms, parents live in the living room. Everybody's leading a different life. They're all on their electronics in separate rooms. These kids are the children that have the highest rates of depression and anxiety. These kids have the highest rates of suicidal ideation. So we want to work on improving family connections. When I meet with families and kids, I kind of like to assess, where are you at with your family strength? How connected are you? The family that's really strong, that has what I call like strong scaffolding, okay? So scaffolding in families is built through positive connections, okay? You look at this family from the movie, and I think it's called Yes Day. They built some of these connections by they're laughing together. That's strengthening it, having fun, spending time together, quality time, positive time is strengthening that scaffolding. We want to focus on that in the younger years, so that when they get to some of these more difficult years, you have something that comes up. We got good scaffolding. It's strong enough, right? So we got a stressor. We find out that child is struggling in a class, maybe brings home a D. If we have that scaffolding as a family, we're able to handle that, or whatever issue they might bring up. Now, if there is no scaffolding, if it's no time, no positive time spent together, no family support, if everybody's living separate lives, then we have no support. And then when something stressful happens to the family, maybe there's a death in the family, maybe drugs are introduced into the family somehow, right? Then there's no scaffolding, it breaks. So part of the job of the family and the parents is continuing to build the strong connections to help kids with managing depression and anxiety. Let's go on to some of this here. Family dynamics that cause disconnection have a high correlation with the onset and severity of a child's mental health condition. The more poorly a family functions, the more serious the child's mental health condition. These are all based on research. As I mentioned before, this is based on the research of Dr. Sansari. 27,000 families he had looked at. The components of a well-functioning family, after lots of research, this is what makes up a well-functioning family. And these are the things that you want to kind of be able to check off. So low reactivity. So low reactivity is when your son comes home, says he's failing a test, instead of getting mad and yelling and why didn't you study? You should have studied, and lecture. You want to be low reactive, and you want to be able to have a discussion with them. Because if we have that scaffolding, we're going to be able to have that discussion with them, and they're going to be able to talk to us. We can talk to them. If we don't have it, they're going to yell, go head to their bedroom, because that's where they live, and there's no discussion. We haven't been able to solve the problem. Important is also that warm and affectionate, right? You want to be able to have a fun, warm, affectionate, lots of hugs. The more you hug your kid, this is giving them it's actually giving them a little bit of dopamine too. Like when you hug somebody, you get some oxytocin and some really feel good chemicals going inside your body. Playfulness. We sometimes think about playing with our kids. That should end about the age of 10, maybe 11, and then we're done. They're in the teenage years. But playing with your middle schooler, with your teenager, is just as important, and actually in some ways more important, because teenagers are dealing with bigger problems. So they need even more support. Playing with your kids as teenagers is going to look a little bit different than when they were little, right? Playing with my teenagers might be going to get a cup of coffee with them, or going on a walk or going on a run with them. It might be biking. It might be going on a drive somewhere. For my kids, like sitting with them while they were practicing driving was playful, and it was fun. It was a good way to bond. Good families are good communicators. So that's not just the kids or the parents, it's everybody has to be able to be a good communicator and work on communication and being open and honest. Good communication happens when you have that strength. And then the key one probably is that collaborative problem solvers. I sometimes, as a therapist, even with my own kids, I want to just tell them, like, okay, I'm going to take care of your problems, and I'm going to tell you exactly what to do. This is what you need to do. You're failing a class, then I I want you to do this. I'm going to get you a tutor. You're going to do this. You're going to do this. You're going to do this. I want to just tell them because I know the answer, like how they can pass that test, right? But instead, I need them to also figure out that answer on their own, right? With my help, I should say. So we want to be more collaborative instead of telling people what to do, telling our kids what to do. You think about how do we feel if our boss comes in and says, this is how you have to do it. Exactly like this, no negotiation. We're not as invested, but when we have that collaborative discussion about, hey, I noticed your grades are slipping in math. What are some ideas? What could we do? What are some options? What could we look at? And let's both throw out some ideas, right? So that collaborative problem solver is especially important the older the kids get. This strong family connection cannot be overemphasized how important it is. In my practice, I do quite a bit of family therapy, and I often say that one family therapy session equals, I don't know, probably 5 individual therapy sessions. So I can see a child, a 14-year-old with depression for an individual session, and that's effective. You can teach them some skills. But if I have parents participating or even siblings along with the parents participating, I can see that effectiveness increase probably 5 times with some of these families because families are with you forever, right? Families are there for you and support you. So we want to really put a little bit more effort in being that strong family to help our child with managing their depression and anxiety. All right. So I want to kind of finish up a little bit with going through all of these. I don't have time to go through each and every one of these, but when I'm working with kids, this is one of the things that we work on is besides other things that we're working on in therapy, this is one of the things I find to be very important. I ask kids to do an assessment when they first come in with me. Where are you strong? Where are we doing really good at? Okay. I have never had a kid with depression, anxiety come in and be able to tell me that they are doing each and every one of them. Sleep hygiene would be number one that kids struggle at. That would be consistently, time and again, kids are struggling with good sleep hygiene. So that's one that I focus on probably 90% of the time. We have to have a discussion about good sleep hygiene. If you look at that down at the list of good sleep hygiene, that means getting up at the same time every morning. Ugh, that's a hard one. That's a hard one for kids. Sometimes they do take it better hearing it from a provider than their parents. But what happens when we're getting up at different times? If I'm getting up at, I get up about 5:10, 5 days a week to run. But if I'm getting up at 5:10, I need to be up by 6:30 at the very latest on weekends. This is for good sleep. If our brain could talk to us, it's going to tell us, I want your sleep schedule to be really consistent. Okay. So, talking to kids about the importance of keeping a pretty consistent awake schedule. The brain does not like it, and it creates brain sleep problems when we're getting up at 6 a.m. 5 days a week, and then no school on Saturday and Sunday. I'm sleeping until 2 p.m. And now I don't know why I'm so tired on Monday and I can't fall asleep. 7 days a week, we want to practice this and getting that 8 to 9 hours of sleep. So, sleep would be probably the number one thing that they are struggling with. But social supports would be a second one that's pretty high. So, that involvement in school activities, work, volunteering, community activities, and friendships. This dealing with problems head on, strong relationship with family members, purpose. So what this means by purpose, because you should all be getting a handout on all of this so that you'll be able to refer to it and use it with your families. But purpose is knowing your values and working daily towards your goals and values. What is important to you? I had a teen tell me earlier this week that her value is a good family, like strong family connections. I was kind of surprised by that response. So that led me to say, we're going to do some family work then, because that's something that you value. It's important for you to have a good relationship with your family. Let's make that happen. Maybe it's sports, maybe it's the future, art, maybe it's art. So, what are you doing for your values? What are you doing that's important, that's moving yourself forward with that? So knowing your goals, knowing your values, knowing what your kids' goals and values are in life. We don't always know, but this is a great discussion to have with them about their values. Talked a little bit about exercise, daily medication. It needs to be taken as prescribed to be effective. So the most important thing for kids to remember is daily. I have to regularly talk to kids about 5 days a week is okay. It's not optimal. We need that 7 days a week for it to really be effective so we can really see the benefits of medication. I put light exposure on here because I don't see it as such an issue right now at this time of the year, but November, December, January, if you start to see some increased depression, usually right around the time change, that's where you start to see some increased depression in some kids. This could be seasonal affective disorder. So if you're seeing an increase in depression during the summer or the winter months, this is where the recommendation might be using a light box. So light exposure, getting outside more during the day, or if nothing else, there's light boxes. You can go on Mayo Clinic, right on one of our web pages, and you can type in light boxes, Mayo Clinic light boxes, and it'll give you a whole lot of information about how to effectively utilize light therapy. The specific title is called Seasonal Affective Disorder Treatment, Choosing a Light Therapy Box. It gives you how to effectively use light therapy to help with treating depression. We talked about good sleep hygiene and then strengthening resiliency. We want to talk to our kids and help our kids to understand that they are going to go through tough things. And our goal in life isn't to take the tough things away from kids, but it's to help them bounce back from the tough things. So if we try to take everything that's difficult away from our kids, they're not going to have that ability to be stronger and be able to bounce back. So working with our kids, talking to our kids about ways to develop resiliency, um, noticing people that are resilient, that have had to deal with some tough things. Because when we build up resiliency, we're going to build up some of that ability to manage depression, anxiety. So all of these, and I'm just doing a quick overview of them. Really, I could talk about them in depthly, but all of these are things that are effective for treating depression, anxiety. If we use medication, that is effective for treating depression in some people, not all people, but in some people. But what if we use 2 or 3 of these? What if we used 4 of these? What if we used all of these? When I see a kid who's using all of these, their mood is more managed. Usually they're ready for discharge. I'm not seeing a kid that's effectively using all of these because these are what's important for depression, anxiety. These are the things that family members can help put into place. I just want to do this is an actual commercial, me doing a commercial. Mayo Clinic Health System is, we have child and adolescent clinical therapists throughout the Mayo healthcare system. If you get to the point that maybe you need extra help in helping your child face the problems of depression, anxiety, bullying, social anxiety, or you need help with helping them learn how to sleep more effectively, at that point, I would look into a child and adolescent clinical therapist, somebody that is specialized in working with children. Children are not little adults. They're actual people that we need to treat a little bit differently. I find with kids, it's different in that I have to use more hands-on things to educate. I use more visuals to educate kids because they need a little bit more to kind of snare them, bring them in. So looking throughout the Mayo Health System for a provider, make sure somebody that is welcoming of family members participating in therapy. Make sure you're finding therapists that are using evidence-based techniques that are having you be active. So you don't want to just go into therapy, vent, and then leave. That's what friends are for. That's what I do with my friends. I kind of vent and leave it, right? I want your kids to be going into therapy, learning something, and being active in what they use. So there's many therapists throughout the community, throughout the Mayo community, that you can get in contact with. If you happen to live in the La Crosse region, we have a program called Empowering Adolescents to Conquer Depression and Anxiety. It's this unique weekly program for adolescents and their families, um, where our goal is to train parents and kids how to effectively manage depression and anxiety on their own. We want to be able to discharge people to managing their healthcare on their own. We want them to be the experts of depression and anxiety. So, through this program that is geared toward middle school kids, high schoolers, and their parents, we teach people how to take control of depression, anxiety, and how to put things in place to successfully manage it. So that's kind of what I have for tonight. Cindy, do we have some questions?
Yeah, thank you, Janice. This has been really fantastic, and I think there are lots of really, really great tips and ideas and things that families can start doing right away, which I think is really valuable. I just wanted to kick off the questions here with maybe you just kind of providing some guidance. So let's say a parent, let's say their child comes into them and they say, I am so tired of being sad, or I feel really, really depressed, or I have anxiety.
Mm-hmm.
I imagine you're not going to say, well, let's go for a run.
Correct.
What advice can you give to parents who might encounter that just really, really tough situation?
Exactly. No, that's great. And that's where I'm going to, as a parent, I want you to applaud your child for being brave to talk about the problem. So this is where we're going to sit down and start. We're going to go more to that. The slide where I talked about facing your fears, they probably had to be really brave to come to a parent and tell them that they're struggling with sadness or anxiety. So we are going to focus on that bravery, and we're going to focus on having them open up about what does that feel like, because you as a parent are qualified to listen to your child talk about what it feels like to be depressed or anxious. And sometimes I think we think I got to call the doctor right away. And it's fine to get a therapist involved and a doctor involved. But I want parents to also say, tell me about it. What does it feel like? What does it feel like inside? What does it feel like outside? What are some of those thoughts you're having? So we're going to focus at that point on really having them open up, and they're facing the issue.
Mm-hmm. Yeah, thank you. Thank you. Okay, so we have just a couple of questions that have come in. If anybody wants to submit a question anonymously, there is a little switch you can flip to submit anonymously. But this first one is about grit. And if you have any advice on helping a child with ADHD who is highly sensitive, how can the parent help them develop grit and perseverance so they can quickly rebound after faced with adversity?
So this is a great question. I facilitate an ADHD group, and this is something I actually talk about for almost an hour. So I'm going to try and put it into like a couple of minute response. This is an issue that comes up a lot because when I talk about resiliency or grit, one way I work on this is, so a lot of kids, we're seeing that they don't have that resiliency or grit when they're losing at a game, right? So what we have to do is we have to have them practice losing at a game. We have to teach them how to lose. We have to set up things where we're going to play a game. You may lose. You may lose this game, and we're going to practice building the ability to tolerate losing. So I think of it as, if I'm not any good at addition, I'm going to practice math cards, flashcards until I'm good at addition. If I'm not good at losing at games, I need to practice losing at games so that I get stronger in being able to say, okay, I lost this game. It's okay. So practicing grit and resiliency is kind of identifying where are you seeing, because there's some areas that child is really good at, right? Certain areas. So we want to figure out which specific areas where are you not seeing that resiliency. The other thing is we don't want to take our children away from opportunities because it's going to be too hard. Like, we don't want to try that. That's going to be too hard for you. I actually want things to be too hard for you, and I want you to struggle with it so that you learn that you have the ability to manage it. When my son was diagnosed with type 1, I still remember him saying, he's a huge sports guy and phenomenal athlete. And he said, I'm not going to be able to do wrestling, and I'm not going to be able to do soccer. I'm not going to be able to do sports. I said, oh no, you're going to do absolutely everything you did before diabetes. You're going to continue. And he did. He actually went on to really, really good sports. He was athlete of the year in his school. So he was able to do it because we said no. We took the answer and we said, we're not going to accept a no, I can't do it. We said we're going to do it. And it was harder for him. It's much harder to do sports when you have type 1 diabetes. You have to work much harder. So grit and resiliency is actually built. You can only build resiliency and grit when you face tough stuff. So instead of avoiding tough stuff, we have to start looking for opportunities to face tough things.
Yeah. So extending this a little bit further. So when you talked about dealing with problems head on, do you have ideas for teens whose problem is feeling excluded?
Yes. And so this is I talk about this at least once a day with kids. In the last 2 years, I have seen a significant increase in kids that are lonely, kids that have great social skills, likable, and they're telling me, I don't have enough friends. I don't have anybody to hang out with. So if they're feeling excluded, what I want them to do instead of feeling sorry or feeling bad, this is that resiliency, that grit part. They need to start working on assertiveness. Now, you have to, as a parent or somebody, help you work on that assertiveness. And I want them to start doing the one asking, right? So you're not getting invited to birthday parties. You start having birthday parties and you start asking people. Nobody wants to do sports. All right, now I'm going to try book club. Now I'm going to try this. I'm going to try until I find somebody that wants to do something. So developing grit and finding not being, just feeling like you're excluded. You have to make it so that you're the one including people.
Okay. So take the ball into your court.
Yes. It is actually, and it's tough. It's tougher than it looks. I actually, people that know me at work or through my friendships know that I'm one of these people that's like, hey, let's do this, let's do that. I'm always trying to get my coworkers to do book club, and they always are saying no every single time. And I have to like let that bounce off me and say, I'm not going to take it personal. I'll try with another, a different group of friends. They say no, whatever. I'll join
a book club with you.
Yeah, let's do book club. Nobody will do a book club with me. But then I try, then I ask like an art activity, and they're all like, let's do art. So it's finding things and then being able to accept that disappointment. It doesn't feel good when people are like, I don't want to do it. Okay, that's uncomfortable, but I'm going to get stronger and I'm going to ask somebody else to do it.
Yeah.
Or I'm going to find something different for an activity.
Okay, so we probably only have time for one more question. And I'm hoping maybe you can do two.
Okay, yeah.
Yeah, okay. So first of all, a parent tried to make an appointment with a psychologist at Mayo, and they were told that no new patients were accepted. Do you have a recommendation for getting in to be seen? That you go through primary care first?
No, you can call so that should not be the case. My understanding, we should not be having a waiting list. So I would call our 608-392-9555 and talk to them about a referral.
Okay. Yep. Thank you. Thank you.
Because we are scheduled way out. That's part of the issue, is that it is scheduled way out, which is part of the reason for this presentation, is trying to get families working on some things before they get into therapy.
Yep. And I actually think we're going to have to end it there. So
okay.
Yeah, sorry. I will try and package up some of these other questions and include responses in the follow-up email. So
sure, that sounds good.
So thank you, Janice. So I would like to thank you for your time and your expertise. It's been really valuable, so thank you. And then I also want to acknowledge the Mayo staff who worked behind the scenes to help make this presentation possible. And I certainly wish to thank all of you for joining us as well. And then, as always, we welcome your feedback and suggestions for future topics. So please, when you get that follow-up email, feel free to email back with your thoughts and suggestions. And I hope everyone has a great evening, and thank you very much. Have a good night.
I appreciate it.